Hello, everyone. My name is Diana Isaacs. I am an endocrine pharmacist and also a diabetes specialist at the Cleveland Clinic. And today I'm going to talk about CGM device options and tips for success. I always like to start off by disclosing that I do speak and consult for a variety of companies, and I've actually worked with all of the different CGM companies, and I don't have any preference for one device over another. My goal is to provide the information about all of the different devices and options so that you can make an informed decision. So, in terms of what I want to talk about in this presentation, I'm going to describe the benefits of CGM for all people with diabetes, discuss the different types of CGM, and then explain some of the common challenges with CGM and tips for success to overcome some of those challenges. So, just a little bit of background information. CGMs are measuring glucose levels every 1 to 5 minutes. And then, depending on the device, they're recording that every 5 to 15 minutes. So, if you do the math, that is actually 288 readings per day. So, it's certainly a lot more information than a person that's doing finger sticks that is just going to probably get a few data points throughout the day. It is measuring the interstitial fluid, which is a little bit different than a finger stick, which actually measures the capillary. So you can see in this image there, it's a slightly different compartment that it's measuring. And then in terms of the pieces and parts, there is this sensor. This is this tiny little filament that's just under that skin in the interstitial fluid. And then there is a transmitter that is on top of that that communicates that information to some type of reader or receiver, or in many cases, that is a person's smartphone. Many of our systems have the sensor and transmitter where it's all in one and the whole thing is disposable. Some systems have a separate transmitter that may need to be saved in between use, or some of them need to be charged in between uses. I like this to illustrate the difference between BGM, blood glucose monitoring, and CGM, continuous glucose monitoring. And what you're seeing here are four dots representing four glucose meter readings. The green represents what we call the target range, and that is between 70 and 180. We're trying to stay above 70 because under 70 is considered hypoglycemia or low blood sugar. And then 180 is generally that peak that we're trying to stay under after eating, that peak postprandial. Now, what you're looking at, that 0 to 24 represents a day, basically 24 hours in the day. And if I saw these four readings in the day, I would say, okay, it looks like this person is in the range all the time. They're meeting their goals, right? Well, what happens when you put CGM on the person? Suddenly you see everything that's happening in between the dots. And it turns out there's actually some previously undetected hyperglycemia or high blood sugar that looks like it's happening after meals. And then what's particularly alarming is this low blood sugar, this hypoglycemia that appears to be happening overnight. And these are the things that we uncover when we have CGM available. Now, you might be thinking, well, what about A1C? Don't we have this A1C test that measures and tells us how we're doing? So, yes, we check A1Cs, but there are limitations to A1Cs. They are based on averages. So, a 7% A1C, which is the goal to be under 7% for most people with diabetes, that actually equals an average glucose of 154. So what that means, that could mean a lot of different things. It's an average. So it could mean a person is in range, and what we consider again in range, that's 70 to 180 all the time. Or it could be on the other side of the spectrum, and it turns out the person is actually spending 40% of the time high, 20% of the time low, and only 40% in range. And you can have all kinds of things in between. And so, yes, while it can be informative to provide an average by itself, it's really not letting us know what is happening and how much variability could be occurring. Why is there so much variability? It turns out there are a lot of factors that affect glucose levels. And this is taken from a wonderful resource called Diatribe. You can find it at diatribe.org, talking about 42 factors that affect glucose levels. And it really varies from person to person. Yes, there's some common things like carbohydrates, a cup of pasta, a cereal. We do expect in almost everyone that's going to cause a rise in glucose levels. But it's so much more nuanced than that. So, for example, some people are really sensitive to caffeine, where a cup of black coffee with no sugar or anything in it can spike a person and cause their glucose level to rise, and another person may have no impact at all. Activity also is very nuanced, where for one person, they as soon as they start walking, they just drop. Another person may notice really hardly any change. And we see that with high intensity activities that actually may cause some people to rise and other people they may drop. And so the point of all this is that everyone is an individual, and to really see how a person is impacted by all these factors, it helps to have real-time data where in the moment you can eat something, you can do something, you can take a medication and see exactly what's happening, not wait 3 months to get an A1C and wonder, did this affect this? Didn't this affect this? So real-time data, all of the devices allow us to be able to see this. And it provides the number, but also an arrow letting you know, is it rising? Is it falling? Is it steady? And for example, let's say you're getting ready to drive a car and you want to check your glucose because you don't want to have a low glucose level while you're driving, right? So you check it, do a finger stick, it's 110. Well, 110 is in the range, right? So it seems like it would be safe. But what if it was 110 and it was really dropping? What if it was double arrows down? That means in the next 15 minutes, you could be really low. And so that's what CGM tells us and shows us. And in addition, there's alerts. So even if you didn't remember to look at it, you can get an alert letting you know, hey, you're low, or even a predictive alert letting you know, hey, in the next 22 minutes, the next 20 minutes, you're going to be low, right? So it can be so helpful for those reasons. So who should wear CGM? Well, it's always good to go to our guidelines, which the American Diabetes Association updates their guidelines every year. So we have the 2025 Standards of Care, which actually came out in December. And so what do they say? They say that CGM should be recommended for diabetes for youth and adults with diabetes on any type of insulin. So that means if you're even on a once a day insulin, in the future, we hope there will be once a week insulin, any type of insulin, you should be on a CGM. Also, they say consider using it in adults with type 2 diabetes that are treated with any glucose lowering med, even if it's not insulin. So, metformin, SGLT2 inhibitors, the GLP-1s, any of those also, it can be very helpful. And I think what's particularly important that they say throughout really all of these guidelines is that the choice of device should be made based on the individual's circumstances, preferences, and needs. And when I talk about the devices, you'll see that there's some differences that may make you want to use one device over another for your particular situation. But what we're highlighting here is that maybe long ago we used to think of CGM, oh, that's for people with type 1 diabetes or people that are on really intensive insulin or are on pumps. That is no longer the case. CGM is for all people with diabetes. Now we have a few different types. And there is something, probably most of the CGMs you're familiar with hearing are personal, where it's owned by the person with diabetes. But there is also this category called professional CGM that's owned by the clinic and essentially lent out to the person with diabetes. And the great part about professional CGM is that the coverage is so good. Now, fortunately, the coverage for personal CGM is getting better and better, where pretty much everyone on insulin has coverage now, and many people, even not taking insulin, have coverage. But there are still some people that their insurance does not cover it. And professional can be a great option because typically it is covered anywhere from 2 to 4 times a year. And it's an opportunity to wear it on a short-term basis up to 14 days and really see what is happening with those glucose levels in response to all those different factors. Now, personal CGM, fortunately, with the coverage improving, more people now have access to this. And personal CGM also has the ability with the connectivity to connect with different, for example, insulin pumps or connected pens. And so and it's meant for long-term use as well. There are two types of professional CGM, and really the big thing to know with these is that if you use a G6 Pro, there's blinded and unblinded, and that just means that you have the ability to be able to see your glucose readings while you're wearing it. The Libre Pro is blinded only, so it's collecting that data, but you're not able to see it until the wear time is over and it is downloaded. Both can still provide valuable information where you can look back at the data and see common trends. And it also can be used to adjust medications as needed too. But majority of people now are going to have access to different personal CGM options or even over-the-counter options, which I will get to as well. So these are all the different options that we have currently at the time of this presentation in January 2025. We have the Libre 2 and now 2 Plus, the Libre 3 and 3 Plus, and both of these are totally they're completely disposable products that do not require any finger stick calibrations and have 1 hour warm-up times. The Eversense is our implantable CGM. And the implantable, it's actually implanted into the upper arm. And then there is an outer transmitter that goes right on top of that, the sensor. The transmitter is required to be able to currently see the glucose readings on the smartphone, but that transmitter can be easily removed. So even though, the sensor is implanted under the skin, it's actually a 1 year wear time. So you only have to go in for this procedure once a year. And then the transmitter you can easily take on and off. And a lot of people like that because otherwise, with the other sensors, it's a little harder to take them on and off because it requires reinserting it each time, which there's a cost to that as well. The Guardian 4 is Medtronic's sensor, and this goes with their 780G insulin pump. You will notice in this picture here that the transmitter has a charger, and so this transmitter is removed every 7 days, and then it is recharged during that time. What's next to it is the Simplera, which is ultimately going to replace the Guardian 4. And the Simplera is inserted much the way that a Libre is inserted, where there's a twist top and it's put on, and the transmitter is completely disposable now. And then at the bottom, we have our Dexcom products, Dexcom G6 and Dexcom G7. And the G6 does have a transmitter that is saved in between uses. It lasts for 3 months, although there is no charging in between use. And then the Dexcom G7 is more, again, kind of like the Libre products and the Simplera, where that transmitter is completely disposable and there's no charging or anything. All right, there's a lot to unpack here. So I've created this chart to really highlight some of the differences between the systems. And a big one is actually going to be the integration. So if you're someone that is wearing an insulin pump or thinking about using an insulin pump, this is really important to know. And I'm sure this is going to be expanding in the near future, but currently the Dexcom G6 works with the t:slim X2. It works also with Tandem's Mobi Omnipod 5, as well as the Beta Bionics iLet pump. The Dexcom G7 works with the t:slim X2, Mobi, and also the iLet. Libre 2 Plus works with the t:slim X2 and with Omnipod 5. And then the Libre 3 Plus works with the iLet. The Guardian 4 works with 780G. And then Eversense So it actually has the status now where it can work, it can be compatible with insulin pumps. There just are not any partnerships yet. Now, what is this 2 plus and this 3 plus versus the 2 and the 3? A lot of people have questions on that. So they're very similar. However, the plus versions now have an extra day to them. So the Libre 2 and the Libre 3 are 14-day sensors, but the plus versions now are 15-day sensors. And there's a couple other differences too. So the other one is the age. The age for Libre 2 and 3 is 4 and over, and the age for the plus versions is now 2 and over. And probably the biggest difference is that the vitamin C drug interaction with these devices, which is actually, all this is on the next slide. So there is an interaction with vitamin C where doses of 500 milligrams or more can falsely increase those readings. And so with the plus versions, they've been able to mitigate some of this interaction where it's much higher doses that would affect the sensor. And the FDA wanted to see this because you could imagine that if you're using this CGM sensor with a pump that's automating insulin delivery, you want to make sure that it's got the accurate number, right? So therefore, they've modified the sensor to these plus versions, and the plus versions are the ones that are used with the insulin pumps, but it doesn't have to be used with an insulin pump. They work really the same as the 2 and the 3 versions, just they have that extra day. So you can use it with a pump or without a pump. Okay, a couple other differences I want to highlight. So type here, probably wondering what's this RT-CGM and IS-CGM? So RT-CGM stands for real-time CGM, and all of our devices now are considered real-time CGM except for the Libre 2. Real-time CGM just means that you look, you wear it, you've got a constant stream of data. ISCGM stands for intermittently scanned CGM, and that means that you need to scan the sensor with a reader or with a smartphone to see the glucose reading. And the Libre 2 is the only intermittently scanned CGM. All right, wear times you'll see are a little bit different. The G6 and G7 are 10 days. The G7 does have a 12-hour buffer period, so you really have 10 and a half days. Libre 2 and 3, 14 days, plus versions, 15 days. The Guardian 4 and also Simplera will be 7 days. And then Eversense, it is 365 days, a full year now. Warm-up times vary a little too. 2 hours with the G6, now down to 30 minutes or less with the G7. 1 hour for the Libre devices, up to 2 hours for Guardian 4. And Eversense, it's only once a year it's inserted, but it is a full 24-hour for that warm-up time. Now let's talk about calibrations. What are those? So that's when you need to do a finger stick to confirm the glucose reading. And it used to be all of our devices required finger sticks. And fortunately now we've gotten to the point where we've really gotten rid of these finger sticks. And so G6 and G7 don't require any. They do have an optional calibration you can do. Libre, there are no finger sticks. There is no option. The Guardian 4 has, for the most part, limited finger sticks. However, they may occasionally be required, for example, to enter into automation. And then the Eversense does require some initially, and then after the first 14 days, it's just once a week. So pretty infrequent. You'll notice there's some differences in water depth. There are differences with sharing data. So all of these have share and follow apps where you can share data with loved ones. And they all allow you to be able to share with your clinic and your healthcare team as well. There's just different platforms depending on the device that you're using. Ages and wear sites are a little bit different. So you'll notice some are the arm, like the G6 is the abdomen versus the G7 is actually the upper arm. Libre say upper arm. Guardian can be upper arm, abdomen, or buttocks, and Eversense is upper arm. Now, that being said, we often use our clinical judgment and the person's circumstances to say, hey, it could be a different site, even though this is recommended on your arm, maybe trying it in a different site might be necessary based on different factors, like if you've had surgery or you have certain um, tattoos or different things in the site that may make it more challenging to use that site. So we often recommend off-label, that there can be other sites to be able to use. Pregnancy is very exciting. So recently, in the last year or two, these devices have been cleared for use in pregnancy. It used to always say contraindicated in pregnancy, and now officially the Libre systems as well as the G7 are approved for use in pregnancy. And then you'll notice here there are some drug interactions. Hydroxyurea is not a very commonly used medication, but that can cause increases with the Dexcom devices and Guardian. Vitamin C, we talked about with Libre, and then tetracycline antibiotics and mannitol with the Eversense. So integrated CGM is an important concept, just highlighting that this is a higher classification of accuracy that is required by the FDA in order to be used with insulin pumps. And this allows the systems to really be used with a variety of insulin pumps for automated insulin delivery. And I've shown an example here in one of the pumps where a person can actually choose what sensor they want to use because all of them are compatible with the pump. And this is really the future where people can choose what pump they want to use, what sensor they want to use, and not be kind of locked into certain devices because there's only one that would work with one system. Okay, next I want to show you the pieces and parts and how you go about inserting these. This is showing you the Dexcom G6, and this is a one button press, and then that transmitter goes ahead and it slides right in. This one will officially say it's approved for use on the abdomen. You can see right there how that's put in. The next one is the G7. And so this is a different way now of inserting it. So this one is actually you unscrew the top and you press down on the skin. So it's approved on the arm. And then once you're pressing down, then you press that button on the side. If you try to press the button on the side without also pressing down, it is not going to go. It's just nothing's going to happen. So sometimes that's an important thing to know. Press down and then go ahead and press that button, and then that transmitter will automatically go on. There's no separate piece to worry about. Here's the Libre 2. So the Libre 2 requires one additional step of inserting compared to the Libre 3. It's also a little bit larger. It's about the size of 2 stacked quarters. So you do have to unscrew it, and then you go ahead and you press it down, and then it sticks on there. With all of these, we generally recommend to press down on it, press the little tape on the side just to make sure it's secure. And the other thing too is before placing these, making sure the skin is clean and dry, washing it, using alcohol, all of letting the alcohol completely dry is very helpful for them to stick. This is showing the Libre 3. So a big difference between 2 and 3 is with the 2, before you put it on, so you unscrew it, but there was another step of actually having to load it. The 3 comes already loaded and it's a little smaller. It's the size of 2 stacked pennies. Now the Guardian is a little more involved to put this on. So there's what you're seeing on the left here is an inserter. And so you load the sensor with this inserter. And so you have to carry this inserter with you to be able to insert it. And then what you're seeing in the middle is that's the sensor. And then you go ahead and you attach the transmitter, which again needs to be charged each of those 7 days. And then there's some tape that's provided to put over it to just help it stay on well throughout those 7 days. Now, this is the Eversense, and this is trying to show you that this sensor is really small. It's placed in the upper arm, and it's a pretty quick procedure, like 10 minutes. This is not like surgery or anything. This is an outpatient procedure that can be done in the doctor's office. And then you see that transmitter. There's this little tape that you can put that transmitter on over it. And it's very easy to take that transmitter on or off if you want kind of a break. Also, this has on-body vibration alerts. So if you don't have your phone with you, you get those vibration alerts. So that's kind of another nice feature with it as well. All right, so those were the personal CGM options, but there is a whole new category of CGM now called over-the-counter CGM. And we have the Dexcom Stello and the Abbott Lingo. And soon we should also have the Abbott Rio, which will be a third over-the-counter option. So the Dexcom Stello it's a little bit different compared to the Dexcom G6 or G7. One of the differences is the glucose range. So most of these devices have a pretty far range. They might go, for example, from like 40 to 400. This has a little bit less of a range. It goes from 70 to 250. So why does it stop at 70? The idea is that this is really designed for people not taking insulin, not taking drugs that we would expect to cause hypoglycemia. And so they don't really need to worry about being less than 70. And it turns out a person without diabetes can easily go below 70 and it's not cause for concern. So it's designed for people over 18 that don't take insulin. It updates every 15 minutes. So instead of that every 5 minutes, it is every 15 minutes, a little less often. And then there's still the same warm up. It's a 30-minute warm up, and it's actually the same form factor as the Dexcom G7. It's just a little darker in color, but the size and everything is the same. Totally different app experience. It uses the Stello app, but there still is a Dexcom Clarity app to review and share your data with your healthcare team. And then there's some additional features like spike detection, but there are not high and low glucose alerts like we can get with the other devices. There's a lot of education in the app, and I've included the website there to go ahead and learn more about that. For the Abbott Lingo, this is a very, very different product than the Stello. So this is also designed for people over 18 not taking insulin. The glucose range is a bit different. It's 55 and it only goes up to 200. So probably wouldn't be great for someone that routinely goes over 200. This, similar to the Libre systems, this updates every minute and it is the same size as the Libre 2, but it is real time. So Libre 2 is actually real time in Canada and other countries. In the US, it is intermittently scanned. 1 hour warm up, and it uses the Lingo app. There are also no real time alerts, but there is a lot of great education in the app. And there is something called the Lingo count. And every time your glucose level goes up, you get points, and you're trying to stay under a certain number of points. So you can see the website there for more info. And then I did a little comparison in this chart right here, comparing the Stello versus the Lingo. So Stello, even though it's based on the G7, it is longer. It's actually 15 and a half days. Although I believe the G7, they're trying to get to go for 15 days as well, but currently it's the 10 and a half. And then form factor, you can see G7 versus Libre 2. The Lingo right now does not have a way to share data. You, of course, the person can show their phone and show what's been happening, but there's not a way to like email the report to your healthcare team or go to a portal and share it. The real-time alerts, neither of them have it, with the exception that the Stello does have this like spike detection where in the moment you can get this alert if you choose to put that on. And then both have great education within the app. And in terms of cost, it depends on how many you buy and how many months you're in it, but generally around 2 sensors, which is a month supply, for around $89. So that is the cost. All right, so those were the CGM systems. Now I want to talk about some tips and tricks for success and overcoming some of the common barriers that can happen with CGM. So drug interactions, right? There are some, especially vitamin C with the original Libre 2 and the Libre 3. And so understanding this is really helpful, especially if you get readings that don't match how you're feeling. There also can be what's called compression lows. So compression lows are when it's on your arm and you're sleeping right on your arm, and it's like all that interstitial fluid gets bunched up, and it reads low. And so ways around this, first of all, being aware of this so you don't freak out if you get a lower reading, especially if you feel fine. So it's always good to confirm with a finger stick if you don't have symptoms. But generally, when you get off of that pressure is released, you should notice that the number starts to rebound. Ways around this, though, is the placement of it. So if you're sleeping on one side, put it on the other, maybe move it a little bit more in one direction so it's not directly on you. And then sleeping on a pillow, like having your arm against a pillow, can help that as well. Dehydration can cause falsely high readings because if you think about it, if there's not enough fluid in the interstitial fluid because you haven't drank enough, it's going to be more concentrated. And so it's actually going to be higher. So if it seems like it's running high, drink extra water. It's always a good idea to stay hydrated. And then sometimes there are just faulty sensors. You just get a sensor that's reading falsely low. Now, we do recommend the first day of wear. The sensors sometimes they're adjusting to the interstitial fluid and they may run a little bit low. And so often waiting it out is a good approach. But if you're seeing like it's toward the end of a sensor or it is, you just put on a new sensor and it's been a day and it's just really, it is not reading correctly, then it may be that you just need to go ahead and remove it and replace it and call the company. But I would say strategies first would be to calibrate if you can calibrate, and definitely to give it a little bit of time to see if it improves. So lag time refers to a sensor where the interstitial fluid, you can think of it this way. So the fingertips are measuring the capillary, okay? And the CGM is measuring the interstitial fluid. So let's say you just ate a meal and your blood sugar is spiking up a lot from that. I don't know, you had like a big Slurpee or something. So it's spiking up. And so if you did a finger stick, maybe it would show it's 200, but your sensor's saying, "Oh, I'm 130." So it's totally normal. Well, what's happening is like a train that's going up a hill. It is going to get to 200. It's just a little bit behind, but it's still getting there. The arrows are going up. It's going to get there. So, in times where your glucose is rapidly rising or falling, you may notice a wider difference, which is why if you are going to do a finger stick calibration, we recommend doing it at a time when glucose is more steady. Our newer systems now have really, this has gotten so much better compared to 10 years ago, where this was a much wider range, but this happens when it is going up or down quickly. And so that brings me to, well, when should you check your glucose with a finger stick? We are not ready to throw away our meters and test strips yet. I wish we were, and I believe we will get there. But currently, there are still times when it's really necessary to do a finger stick. And actually, the ADA recommends that every person with CGM should have access to a meter and test strips. So one would be some of our devices do have like in the first 12 hours of use where they recommend confirming if you're making dosing decisions off of it, or let's say it's reading low and you're thinking of treating it, um, to confirm with a finger stick. But really, anytime symptoms or expectations don't match the readings. So let's say it's saying you're 50 and you feel fine, so confirm, maybe you're not 50. And so you'd want to confirm before just eating and drinking tons of food to try to raise it when maybe it's not really low. Other times would be if you're taking one of those substances that could affect it, like vitamin C. And then I also put after correcting a low because remember with that lag time, it may take a little longer to see the change in readings, especially if it's a system that's updating every 5 minutes. It just, you're going to have to definitely at least wait, right? Like it's going to be 5 minutes before you see another reading. So it may be better to do a finger stick so you can confirm, okay, it really has gone above 70 now. I don't need to keep eating and drinking additional things. A common one is my sensor fell off or it's not sticking. So fortunately, there's a lot of great products that can help. There are things you can put under it, like Skin Tack or Mastisol. And then there's a lot of beautiful overlay patches as well. I believe everyone can find the right combination. But the key is figuring out what works for you. And especially if you're someone that exercises and maybe sweats a lot, you may need something a little bit stronger. The other thing I want to emphasize is that if something happens to your sensor where it falls off early, it malfunctions, it's a faulty sensor, please call the company. You need to know the serial number of it. Like they're going to ask for the information, but please call and ask for a replacement because unfortunately a common issue I see is that if someone's fell off, there was an issue, and so they want to go to the pharmacy to get more, but the pharmacy can't dispense more through your insurance. They only allow you enough for the number of days. And so it is the best to call, or a lot of times you can do it in the app or you can do it online, but go ahead and ask for that replacement so you don't end up without sensors for a number of days. And then try these products, especially if you have issues with them not staying on the full time. Try these different products. There's so many things. You can find a lot on Amazon. So another common thing I hear from people is I'm getting too many alerts. I don't want to wear this because it's waking up my partner all night. So you can turn off almost all of the alerts. So some devices, the over the counters don't have alerts, right? But with our other products, you absolutely can turn off a lot of these. And I've actually shown two examples. The one on the left is Libre. Libre has a little bit less alert options. So there's this urgent low that's below 55. Most of the devices, this below 55 it's defaulted on. It's a requirement from the FDA. And so that is typically going to go off and you can't turn that off. But you'll notice there's a low, there's a high, there's also a signal loss. And a lot of times I turn off the signal loss because I find usually the signal comes back pretty quickly and it's just one extra alert. But low and highs, these should be individualized. So you can see the highest set for 160. That's probably not going to work for most people with diabetes. Like that, it's easy to hit 160 anytime you eat. And so really individualizing these and even considering just turning them off so they're not a nuisance, but making it actionable. So maybe you want to know when you're 200, maybe you want to know when you're 250. It's going to be individualized based on a person and what meds they're on and everything else. The one on the right is Dexcom G7. There are more alert options here, but actually everything can be turned off, and there's even a quiet mode where you can turn off the urgent low if desired as well. But there's some additional ones like rising fast, falling fast. There's even within the high that you can delay the first alert, so that if you only want to know if you hit over, let's say 200 and you're there for an hour or 2 hours. So all of these can you can turn them all off. You can turn many of them on, but the key here is that you probably don't want them all on because that could end up really being overkill. Some people want their falling fast because they really worry about low glucose levels or hypoglycemia. So you should work with your healthcare team to figure out what's going to be best for you so it's actionable and it's not just annoying, right? And then my last thing I wanted to touch on is cost and coverage, right? Because this is the elephant in the room, right? Wouldn't everyone use CGM if it was affordable? Well, actually, it's becoming more affordable than ever, and a ton of people have coverage for it and don't even know that they have coverage for it. So please, I want you to know that if you're taking insulin, you most likely have coverage. Medicare in the last couple of years expanded their criteria to where they cover it for anyone on a once a day insulin. And we see that many other insurance companies have followed that. Where I live in Ohio, Medicaid covers CGM for anyone with diabetes. Doesn't matter what you're taking, it doesn't matter if you're not on any medications. It is covered, it is free at the pharmacy with a prescription. So every state is going to be a little bit different, but the coverage has improved tremendously. Let's say you don't have coverage, your insurance doesn't cover it. Well, if you're on a commercial insurance plan, actually there are some programs like Libre, for example, has a program where the max cost out of pocket should be $75 per month. And they actually have a number you can call if you're ever asked to pay more than that. that should bring it down to not more than $75 per month. Dexcom, as well as the other companies, also have different copay assistance as well. There are some patient assistance programs, although those typically are geared more for people with type 1 diabetes at the moment. But also keep in mind there's the over the counter CGM, and that is typically not more than $89 per month. And if all of these options are still not options, there's still the professional CGM that you can ask your clinic about, which is typically covered at least 2 to 4 times per year. And the other thing I like to add is it is not all or nothing. So maybe you can get it for $75 a month, and that is simply too much. Well, that should cover 2 sensors. So maybe you can stretch those 2 sensors and use those over 3 months or over 4 months. Some CGM is better than no CGM. And any CGM is going to be better than just one finger stick a day, which provides so little information. So you can really get creative with different ways to at least be able to get a taste of CGM. And so, with that, just a few summary points I want to leave you with. There are many benefits to CGM, especially understanding how you respond to those 42 factors. There's a lot of different options, there's different features, different compatibilities with different insulin pumps, different alarms, alerts. And so ultimately, you can decide what may work best for you. And then common barriers can definitely be overcome with knowledge and preparation. And with that, I thank you so much for listening. Here is my contact information on Instagram, Twitter, and now Blue Sky as well. And then I do a podcast with Natalie Bellini that you can find at hcplive.com, as well as anywhere where you get your podcasts. Thank you so much for listening.